So it is my pleasure during the month of October, which is Health Literacy Month, to be moderating this session. In terms of our panel, I can't be more pleased to be sharing the stage with our members as well as our guests from the Milken Institute. We know that health literacy is a global issue. We know that it's a contributor to inequities and disparities. We also know that it's a key influencer for patient outcomes. So it is my pleasure to actually give a brief overview before I turn the mic over and the podium over to our guest speakers, to give you a bit of a perspective on some of the work that we're doing. And that work is always informed by what we're hearing from you. So in terms of health literacy, we wanted to take a bit of a look in Asia Pacific. And the reason we started there is because prior to my joining the organization, there was a community advisory board that was held on health literacy in the region. And that community advisory board gave us such valuable insights that it helped pave the way for us to determine what some of our priorities were, but also what we needed to understand better. We didn't really have a good perspective on some of the national health literacy policies and strategies in the region, so we decided we were going to do a deep dive. We wanted to really look at and examine and better understand some of the key issues and the challenges and the barriers that patients are experiencing in relation to health literacy in the region. And one of the valuable pieces of doing that is we were able to identify that there's a lot of commonalities between what was happening in Asia Pacific, what patients were experiencing, as well as caregivers around health literacy on more of a global scale. So it's helping us set the stage for working more at that global level in this area. We also wanted to look at what we could do in terms of policy actions to help address health literacy inequities and disparities. And some of that work also involves what can we do to help all of our members who are already actively engaged and advocating within that policy field. So it's not necessarily what we're going to do as Lymphoma Coalition, but also what we can do to help you. So just to give you a little bit of an overview, we did look at 10 countries, and often people will say, well, how did you choose those 10 countries? We looked at a lot of factors, including representation from the Community Advisory Board that we held on health literacy a few years back, but also where our members are active and where we really wanted to source out more of that information. So these are the 10 countries that we started with. I say started because I think we're going to be continuing that mapping globally. And then we looked at some key areas of policy focus. So we wanted to understand with that policy lens what some of those areas might be. And the first place, of course, was which countries have national policies or strategies relevant to health literacy. We wanted to also know where's the money. We wanted to know which countries are funding these initiatives. It's one thing to incorporate it into the health agendas and into the national strategies, but if it's not funded, then how does it actually move forward? We wanted to know what their priorities were from a policy perspective. And even more importantly, did they actually prioritize, or were they just at that early stage of starting to understand that? And then most importantly, as Lorna will attest to, where's the data? We wanted to know which countries in Asia Pacific, but also around the world in the future, who's actually tracking and reporting and measuring population health literacy. We grounded all of our work with a very set and defined methodology. And I won't make it boring, but I might not be able to spruce it up too much either. So we really looked at what those policy research questions were going to be. They're listed here. What's the state of health literacy? How are they addressing health literacy? Again, from a policy research perspective. What were their key areas of focus? Who is responsible? It's great to have an action plan, but not so great if you don't know where you're going with it. And what are the measurement mechanisms? So it was not a surprise in terms of the findings, and I'll just go over this briefly, but 80% of the countries indicated that their health literacy was low, inadequate, or problematic. And you can see the numbers are relatively in range. There's a few surprises, perhaps. New Zealand was on the low side, but then we were able to also identify some of the cultural considerations and the demographics. We also showed that 20% of the countries actually reported that they had higher or high functioning or functioning levels of health literacy. I will point out China is one of the few countries that's actually measuring, so they really have this data, and that's why we were able to show you what that increase is by year. So just in terms of the state of health literacy, really quickly, no surprise that we have some national strategies in place, 40% of the countries. We also have 30% that are in development for national policy and action plans. So they've identified it, it's on paper, they're in process of moving it forward. And then 10% respectively for policy development, having it in the National Healthcare Plan, which I believe is Japan, if I'm not mistaken, and 10% with state strategy development, and that was Australia. So really just looking at who's collecting the data and who appears to be lacking some of that data. So in terms of priorities and actions, this was a bit varied, which was really quite interesting for us and gave us a lot of content to work with. So one thing was the common denominator, creating a health literate environment, and we were thrilled to see that. We also saw a few other pieces that we weren't surprised about. Very happy to see health literacy research happening in some of those countries. And then just a bit of diversity in terms of their priority areas or their areas of focus. So certainly promoting individual health literacy, the population health literacy, increasing some of that. Really happy to see utilizing health strategies to address those inequities. And I really love this quote. And Jarek, I'm going to pull you out because it's from the Philippines. I really liked seeing that in their national health promotion framework. Health enabling public policies that are also health supporting, critical. So kudos to who put that in. I really like that. In terms of the funding, we talked about, it's great to have a plan, but if you don't have the money, how are you going to implement it? We had a really hard time finding out if they're funding health literacy and how they're funding it. But we were able to identify that it's happening in 30% of those countries. As well, China allocated substantial funding. We were actually surprised at that dollar amount. 40 million US dollars is not too bad, I think. And then Korea, we see it included in the national plan. Philippines, no more than 1% of the budget. So we're hoping to see that increase over the years as the initiatives and the programs start to evolve. And then while Australia has a national statement, they leave the funding to each state, which means there's a lot of variance between which states are allocating the money toward health literacy. So some of the key report takeaways really quickly: policy, social determinants of health, the data, health systems, advocacy, and communication. So what does that mean? Whenever we looked at all of the key findings, 6 key areas kept surfacing up. Policy in terms of capacity building, understanding what can be done at that systems level. The social determinants, really looking at closing those gaps around those inequities, but also understanding what are the root causes of health literacy, and what are the underlying factors that ultimately impact those patients and patient outcomes. The data, again, we believe people should be measuring health literacy at the population level. It gives us the data we need to be able to work with, and I hope many of you feel the same way. We'd like to see that, being measured more, but not just measured, reported and tracked. At the health systems level, just defining some champions. We think about personal or individual health literacy and organizational health literacy, and I know Catherine's going to speak to that. We want to see it at the systems level as well. It's not just our personal responsibility to have that higher level of health literacy, but it's also our healthcare system. In terms of advocacy, seeing it integrated into that healthcare planning and educational curriculums and training as well for our healthcare professionals where it's needed or applicable. And then communicating, using health literacy as a real driver to really improve those communications across the health systems. So it is my pleasure to introduce each of these speakers as they come. We do have a short period of time for questions at the close. So I would like to introduce Catherine Sachs. So Catherine is an associate director in health economics with the research department at the Milken Institute. Her focus is on population health and social determinants of health in the United States, with a specific emphasis on health disparities. She's also focused heavily on adverse maternal birth outcomes and the effects of the social safety net on measures of population health. Prior to joining the Milken Institute, she was an instructor of public policy at North Dakota State University and the University of North Carolina at Chapel Hill. Catherine holds a master's and a PhD in public policy from the University of North Carolina at Chapel Hill, a master's of science from the London School of Economics, and a bachelor from Barnard College. So, Catherine, it's all yours. I'm happy to turn it over to you.
Okay, let me see if this works. Yes. Can everyone hear me? Great, okay. So thank you so much for coming, and thank you to the Lymphoma Coalition for the generous invitation to speak, and to Marjorie for putting together this very timely panel. Happy Health Literacy Awareness Month, everybody. I'm just going to provide a brief overview of health literacy in general and how the concept has developed into what we see today. So health literacy is a relatively recent concept, gaining some traction in the late 1990s before really taking off in the 2000s. This image shows a Google Ngram result for all uses of the term in English language books published between 1990 and 2019. So as you can see, it's really ticked up in the last 15 years. The definition of health literacy has evolved from the earliest definitions, such as that from 1998, which Don Netbeam wrote for the World Health Organization, which defined it as the cognitive and social skills which determine the motivation and ability of individuals to access, understand, and use information so as to promote and maintain good health. The US government's Department of Health and Human Services, in creating their decennial health roadmaps, Healthy People 2010 and Healthy People 2020, emphasized the capacity to obtain, process, and understand basic information and services to make appropriate decisions. And that evolution there is the mention of services. And finally, in the latest iteration of Healthy People for 2030, the distinction is made between personal health literacy and organizational health literacy. So personal health literacy is an individual's ability to find, understand, and use information and services to inform decisions and actions for themselves and others. Organizational health literacy, however, is the degree to which organizations equitably enable individuals to find, understand, and use info and services to inform health-related decisions for themselves and others. So the key point here is that the onus is on organizations, healthcare providers, payers, etc., to enable individuals rather than placing the burden on individuals themselves. By emphasizing organizational health literacy, the latest definitions recognize that health literacy is not an individual failing, but a systemic problem. Health literacy is context dependent and variable. So for example, while I am passively health literate within the United States healthcare system, my level of health literacy would be measured as quite low if I were to move here to Spain or to any of a number of other countries which you all represent. So I would say that we can consider health literacy to be one of these social determinants of health. And if you're unfamiliar with the term, social determinants of health represent someone's environment and the conditions around them that can affect health risks and outcomes. So things like their economic conditions, their education level, or even the physical environment. And one model of health literacy that I think does a good job of integrating the concept in both the individual and the broader context is this model from Sorensen et al. And this was used when creating the EU Health Literacy Survey. So the EU Health Literacy Survey took place in the early 2010s, and actually the research continues through the World Health Organization Action Network on Measuring Population and Organizational Health Literacy, or MPOL, who administer the European Health Literacy Population Survey periodically. So the first EU HLS back in the early 2010s, these are some results. Unsurprisingly, the Netherlands was the obvious standout for higher health literacy. Notably, Spain, where we are today, has more than 50% of the population possessing problematic health literacy. And while its proportion of the population with inadequate health literacy is lower than for all of these European countries overall, the combined portion who have less than sufficient health literacy is second in this graph only to Bulgaria, and more than 10 percentage points higher than for all of these Euro countries. So this data from the more recent MPOL survey does not show exactly the same countries because countries opt in to participating. But what's notable in particular is Germany, which had less than 50% of the population demonstrating less than sufficient health literacy in the earlier data. You can see Germany there. But now has more than 70% of the population with less than sufficient skills. So this just demonstrates the importance of recurring measures, as data can change and data can drive the correct policies. So in the US, for example, the most recent population data on health literacy is from 2003. That's when the internet was brand new. And we can recall from earlier slides, that's also the beginning of the increase in the concept and salience of health literacy. So what we would find today would probably be quite different. We also need to ensure we're measuring health literacy among the entire population. So that includes people who are often missed. For example, linguistic minorities. We also need to establish agreed upon set of standards to measure organizational health literacy, both society-wide and at individual organization levels. This will allow us to measure how accessible our system is and to facilitate improvement. By making the results public, we can monitor organizations and hold them accountable. So the advantages of investing in health literacy are many. More health literate people use fewer healthcare resources and they cost less to care for, but they also show better health outcomes, so it's really a win-win situation. Investing in health literacy is also a means of increasing equity and access. Part of the reason historically marginalized groups have worse health outcomes is because they lack the information necessary to access what they need, while better resourced people often know how to navigate the system. By changing the system, rather than targeting millions of individual people, we can change outcomes. So this is done in part by communicating more effectively, targeting information to circumstances, and even using non-traditional means to disseminate that info. A good example might be Elvis being vaccinated on The Tonight Show back in the middle of the 20th century. It was a very successful use of a then new technology. On that note, technology does have a role to play. For any providers in the audience, patients in the audience, I'm sure you know that electronic health records and patient portal integration is not an unqualified good, but they do allow for the tailoring of information and communication based not only on a patient's health prognosis, but also upon their broader circumstances. You can even integrate one of the many health literacy screeners that exist for provider-patient use. Assistive or adaptive technology can also increase accessibility for people with disabilities or with lower native language proficiency. That said, technology is only as useful as it is usable, and unequal access to hardware, software, broadband, or even to electricity means that these solutions are not necessarily appropriate in every context. So beyond the benefits of overall health literacy, information on its benefits for cancer specifically demonstrate how valuable health literacy can be for lymphoma coalition members or others with other types of cancer. It is associated with many cancer-specific outcomes, such as the uptake of cancer screenings, receipt of prescribed chemotherapy, and the lowered risk of postoperative complications. Cancer patients with low health literacy are also at greater risk of being hospitalized. It's important to note that general health literacy and disease-specific cancer health literacy, they're related but distinct. So it's worthy to note that Papadakis et al. Found the incorporation of an educational program improved disease-specific knowledge and prompted patients to become involved in their care, improving health behaviors and outcomes. Lower overall health literacy was not a barrier to this beneficial effect. For cancers especially, we cannot emphasize enough the critical role of caregivers. Per Wittenberg et al., with their pivotal role in cancer care, their demand for information has increased, yet they have been left to actively advocate for their own support and informational needs. it is pivotal for healthcare centers to provide caregiver communication, training, and support. Key things to keep in mind about health literacy are that information needs to be understandable, and people cannot be passive recipients of information. For provider, patient, or caregiver interactions, best practice includes the use of the teach-back method, where patients repeat back in their own words the provider's information as they understood it. Additionally, any information or interventions need to be appropriate to the context and account for circumstances. How info is delivered also matters. Non-traditional means or venues for dissemination can be very successful, and there's a dosage effect. The more a message is heard, the more likely it is to be retained. Lastly, I want to emphasize that equity should be foremost as we consider health literacy. By referring back to community-based participatory research principles, or CBPR, we can engage community members about what is actually needed or might succeed, as they are the experts. Cultural appropriateness is also key. I would refer you to the culturally and linguistically appropriate services, or CLASS standards. Training in CLASS and health literacy more broadly is beneficial not only for physicians, but for others. For example, nurses, pharmacists, whomever. Training in health literacy or health communication is already being required in some US states for physicians as part of their continuing medical education requirements, but that could be expanded. Finally, and most importantly, meet people where they're at, both literally and figuratively. So you can see this editorial from The Lancet last year, and it claimed that health literacy as a concept is failing. However, I think that they misunderstood fundamentally what health literacy today is. They emphasize individual skills, which they claim neglects the societal and structural forces that shape our choices. I'd point you instead to this response from Don Netbeam, the author of the 1998 definition of health literacy, an expert by any measure. He points out that the failure belongs to people in the system and to the systems. Health literacy is more than an individual skill, and by improving communication and reducing demands on consumers, we can start to improve. So remember, low health literacy is not a deficit held by a particular person that said individual must work to remedy, but a system-wide failure to ensure people understand the necessary information to maintain and improve their own health. There is more information, if you are interested, in this 2022 report that we put out. It is linked here in the QR code. I'm also happy to talk about it. Please reach out to me, shoot me an email. My slides are available on your thumb drive. And thank you so much for your attention. I hope I made my time. Awesome, thank you very much.
It's now my pleasure to introduce Win Yu. Win is an advocate focusing on patient engagement through the whole drug life cycle and helps to solve the pain points and the needs of businesses and patients in the Hogmean Charity Foundation, and she's been doing that since 2021. She's conducted a series of workshops focusing on patient engagement mindset and practice, and I'm happy to say that Win recently published a book titled Best Practice of Patient Engagement in the Entire Life Cycle of Medicines. I'm going to be reading that. And her book has been referenced as a breakthrough and milestone in patient engagement.
Okay, thanks, Marjorie, for the introduction. Good morning, everyone. First, I'd like to thank Nona and Marjorie for inviting Hongfei and me to this meeting, and also thanks Kim for her great support so that we could come here smoothly. It's my great honor to be here to speak on behalf of House 086. Actually, I have been here in Madrid in 2017 when I was working in Roche. I came here to attend the 9th IPO held by Roche Global. And with Hongfei, the founder of House 086, and I think most of you have known him before. And just at that time, House 086 joined the LC as the 68th member. And 6 years later, I'm here again, but this time representing House 086, which I joined 2 years ago. So followed by Marjorie's introduction about the health literacy in the Asia Pacific. Here I'd like to give you some more information about health literacy development and status quo in China. And the former Ministry of Health issued the Basic Knowledge and Skills of Health Literacy of Chinese Citizens, the trial version, in 2008. And after that, health literacy has increasingly been embedded in national policies and action plans, and the indicators of health literacy has been included a number of national assessments. And in 2016, the Chinese government released the outline of the Health China 2030 plan. And after that, the Healthy China Action 2019 to 2030 clearly identified a number of specific targets, including a health literacy level by 2030 of not less than 30% and achieving a 15% of 5-year OS rate by 2030. And the policies encourage governments at all levels and the institutions of healthcare and education, sports, media, and NGO to popularize health knowledge by distributing health materials and health posters and setting up fitness equipment and giving away healthy lifestyle tips, etc. And the monitoring results showed that the health literacy level of Chinese residents is increasing year by year, and by last year, it has reached 27.78%, exceeding the target of 22%. And when it comes to patient population, in China, a patient-centered healthcare ecosystem is being established from the national policies providing more specific guidance on patient centricity to pharma industry practicing a patient-centered philosophy, from more clinical experts and institutions caring more about patient experience to more suppliers using advanced technologies and methods to deliver patient solutions. And most importantly, the continued growth and increased influence of patient organizations has led patient organizations to have increasing involvement at the policy level. And for lymphoma disease area, a study of 3,760 patients enrolled conducted by Beijing Cancer Hospital showed that from 1996 to 2000 interval to 2011 to 2015 interval, the 5-year OS rate has climbed from 48% to 65%, gradually approaching the level of developed country. Although this result can't stand for the overall situation in China, but it still can reflect the progress in this field of treatment. And in addition to standardized diagnosis and treatment and the innovative drugs and also the personalized solutions, we think the improvement of health literacy of patients is also a very crucial factor. And in 2018, Health 0 at 6 participated in LC's global survey for the first time, and the results showed that the patient's demand for relevant medical information is obvious, and the demand of Chinese patients is more urgent. And we can see from this graph, only 12% of Chinese respondents said they had sufficient medical relevant information compared to 34% of the global respondents. And we think the reasons may be the large amount of patient population in China, the uneven allocation of medical resources, and the different cultural, economic, social, and educational background across China. So how do we close the gap? How do we improve patient health literacy? First, let's take the posting of patients on uncertainty on Health 0 at 6 forum as an example. We can see from all the topics mentioned by patients, the treatment and the associated side effects made up the majority. And then is the diagnosis, as lymphoma is a very complex disease, and then psychological issues and diet and exercise also mentioned a lot. So we think what patients concern most is what we need to focus on and address. So in order to meet patient needs, there are a few questions we need to ask first. First, how to ensure that patients have easy access to information, and how to ensure information is credible and easy to understand. and how to precisely provide information to meet individual needs, and what else can be done to improve health literacy more broadly. So first of all, we think convenience is fundamental, so we provide multi-channel online platforms. When a patient or family member know about health there at 6 through patient or HCP recommendation or just through search engine directly, they have the access to our website, WeChat official account, and app or mini program. A different platform has different characteristics, so it can adapt to different needs. And on these platforms, patients can learn from this platform and interact with other patients, and also get targeted subtype patient services. And also, on these platforms, we can gather patients easily and generate real-world evidence. And by this year, we have accumulated 120,000 registered users and more than 20,000 new users per year. And many patients get feedback on a significant reduction in anxiety after finding this patient organization. And secondly, to provide professional and accessible knowledge, we not only have basic knowledge to those who know nothing about lymphoma, but also cutting-edge treatment information. For example, we invited medical experts to interpret professional knowledge from ASH conference. And we also have the articles written by patient experts. And this patient whose nickname is Orange Ray, he is just such a patient expert, and his articles is very popular among patients. But to ensure the accuracy and the scientific nature of such articles, these articles should be approved by medical experts, and it will be showed at the end of the article. And we also have a column for clinical trial, including the latest clinical trial information and the basic knowledge about clinical trial, and also FAQ. We have paper books for elderly patients who are not good with electronic devices. And such knowledge and information enables patients to understand that lymphoma is a kind of curable disease and establish a correct and positive treatment concepts. And to support patients more precisely and more efficiently, we classify the knowledge according to different disease subtypes and also knowledge types, so they can access the knowledge they need very easily. And we give each patient the individual neighbor so that they can get targeted services. These are our colleagues who manage different subtype groups. And we also have online and offline seminars aiming for specific disease subtypes. And at the same time, the sharing and exchange of real experiences allow patients to get more support and build confidence in recovery. On these platforms, we have patient stories, treatment diaries, recovery reports, and patient mutual assistance. And we also have a fitness group to encourage patients to stay active, and a mindfulness camp to help patients with anxiety and depression. And compared to professional knowledge, sometimes such emotional support and daily guidance seems more important. And at the same time, we improve patient understanding of the meaning of data, let them know that real-world evidence can help the officials, the payers, the policymakers, and physicians to better understand the patient's real situation so that they can make or improve the policies to help patients. This is an article written by Hong Fei calling for patient data, and these are white papers on patient survival we released annually. And we use this data to communicate with relevant stakeholders for patient benefits. And in a wider population, we also improve public awareness about lymphoma. For example, on Lymphoma Awareness Day each year, we held activities or released relevant videos. And we know that correct awareness about lymphoma can help patients, can help this disease get more social attention and eliminate the discrimination against patients. so we can help patients to be reintegrated to society, like schooling, employment, have marriage and children, etc. And also at the same time, such publicity advocate for a healthy lifestyle and to prevent the occurrence of some disease. So at the same time, we improve the health literacy of the whole population. And during these 12 years of work, we understand that, we know that health literacy is not just having some knowledge or information, but it's also understanding how the healthcare ecosystem works so that everybody can participate in it and work together. And China Lymphoma Patients Conference is just a multi-stakeholder communication platform, and we held it this year for the third time. And these are the keywords, and the slogan is, I love CR, more love you. And the lovely images and the slogan reflects the care for people, not only for patients, but also the family members and the friends who have always been with us, and the physicians who have treated us, and the scientists who helped us, who provide us with drugs, and also the officials, payers, and policymakers who support us to access drugs, etc. So when the stakeholders received the trophy from patients, they said it's the most precious honor in their career life. And although we don't have specific data to show how much health literacy we have improved, but we can see that from the results from the study I just mentioned, and also from the wonderful lives experienced by patients. And this patient, he has fulfilled his life dream by participating in a bodybuilding competition. And these two girls who were both patients, they became good friends and opened a bakery together. And this patient married another patient's sister and have a happy marriage. And this couple, who were both patients, they have had a lovely baby, and Hongfei has had two lovely girls. Yeah, and many patients even gave feedback that they used to be ashamed of being sick, be ashamed of being diagnosed with lymphoma. But after finding this patient organization, after communicating with so many patients and also attending such a high-level conference, they no longer ashamed of the disease and no longer worry about the recurrence because they always have the hope. So I think that's all our work is all about. Thank you.
It is my pleasure to now introduce Jyoti Patil Shah. Jyoti is the Chief Executive Officer of VCare Foundation, a not-for-profit patient care organization started by Vandana Gupta following her cancer treatment. And Vandana is with us today because of the challenges that Vandana faced as a patient. VCare Foundation believes in empowering cancer patients with care from chaos to control, and has its trust office in Mumbai, India. Since 2008, Jyoti has held various roles with VCare Foundation, including serving as the program manager for patient access and the chief operating officer. And I am so pleased to say that Jyoti in 2021 was a member of that community advisory board for health literacy, and that advisory board helped give us quite a lot of information for our report. So I'm quite pleased with that. Jyoti has a bachelor in psychology, a master's in industrial psychology, and a master's in counseling psychology, along with a diploma in medical transcription. Welcome, Jyoti.
Good morning, and thank you, Lymphoma Coalition, for this opportunity. A little bit about So VCare has been in the space for the last 30 years in cancer care, and it's a very patient-focused organization. As Marjorie mentioned, it started by Vandana Gupta, And we have been able to reach more than 7 lakh patients in the last 5 years. So coming to health literacy, I'll share a few patient stories that I have. When we talk about health literacy, it's not a new term. It's been there always, because I think each one of us are so informed about what happens to us. When we talk, COVID basically has taught us a lot of things, and that's when we became aware of, okay, if you have fever more than 3 days, what do you do? If you're coughing constantly, what do you do? Earlier, it was not that. Earlier, it was just, getting your whatever medicines you had at home, take it up and, get cured by yourself. So here I have Shulmit. Shulmit is a lymphoma patient. He's just finished his treatment with immunotherapy. Shulmit is somebody who has been, he is a chef by profession. He was working in Dubai at JW Marriott. A nice career, everything going well. 2019, he was not keeping too well and constantly falling ill. But something that triggered him to come back to India was he wanted to, take medical advice back home. And at the same time, his mother was diagnosed with breast cancer. So they were, he was also going to the doctors with his mother to get her checkups done. Simultaneously, Shulmit also got his test done. But it never struck him that it could be cancer, because he was having fever, he was having multiple things that were going on. Finally, when he came down to India, he had his test and he was diagnosed with cancer. But he was somebody who was as an educated person, was aware of what his body was telling him. He was aware that something was very different than the regular times he has fallen ill. And the constant, the fever which was coming, going, which is what got him to go and do his tests further. And at the same time, when his mother was undergoing, I think he said it just compelled him to do those tests ahead. Because that's how he thought, let me see if nothing normal is there, what is the other abnormal that could be happening. He was diagnosed with lymphoma. He got treated. During his treatment, I think in 2021, he reached out to us for fund support, and that's how I know him and I know his, his story. So gradually, he was doing well. 2022, I think there was a relapse again. Again, he went, that was the time when he got married to his girlfriend. And it's a beautiful story which we keep on telling during the patient support meetings or, the awareness programs that we have. Now, the stories like these help us in creating that awareness between the general public that cancer does not mean death, because that's how the definition of cancer is actually. The stigma of cancer, again, is not so good. So people, whenever they are falling ill, naturally none of us will go back and say, okay, let's go first do a cancer test. Everybody will say, okay, let's figure out what's wrong, everything normal. Then I have another lady. She is a school principal. She was diagnosed with breast cancer. Not in Bombay, but in a city, Pune. Very well-read, a school principal naturally who has so much knowledge about what's going on and everything. But her dilemma after diagnosis, do I talk about it to others? Do I speak about it to others? Because she was worried that maybe her daughter, who was of marriageable age, will not be able to get married. And the thing, and I met her during one of our patient care programs we were having at the patient housing where she's staying in the hospital. And when I spoke to her, she told me that she loves life. She does so many things. And she knows that she's going to get well because she knows that she'll come out of it. Her doctor has given her that confidence. Her breast cancer was, diagnosed at an early stage, and which will be taken care of, and she will do better. But still her thought process was so much more about the negative emotions that were there. It was again that she was well informed about what her disease is, how her disease is going to be culminated into getting treated, and still she was not so sure about what's going to be. Here is another mother, the one in the white. She was not sure when I asked her, because her daughter has been diagnosed with blood cancer, the one in the black. And when I spoke to her, I said, "How did you come to know about it?" She said, "But I never knew that there was something like blood cancer." She was like, "I thought cancer was a disease of people who were chewing tobacco, who were smoking cigarettes." She never thought that there are different types of cancers that can affect. And she was somewhere in a stage where she was preparing for her daughter's marriage, and she had kind of all ready to get her married and everything, but then cancer struck, and then that's how she was like totally naive about the disease. Naive in terms, she didn't knew how do I explain my family there is something like this. No family history of cancer, there was nothing that could happen to her, is what she thought of. But there are so many things when we talk about, like yesterday I was having a discussion with Vandana in the evening, and I asked her, I said, "What was your thought when you were diagnosed 30 years back?" She said, "I knew that I had Hodgkin's, but I didn't knew that it was cancer." And she was happy with the name Hodgkin's that came there. So it was, and her niece, who has just been diagnosed 7 months back with breast cancer, she is a doctor herself. But her cancer was diagnosed at a later stage, at I think it's a 4th stage. She's just completed her treatment. So it's not about how educated you are, or from which or how much, what level of degrees you have, but it is about how informed you are of what is happening around you. So when we have, Kate mentioned about the definition of health literacy, it just means very simple. It just means that we have to understand, knowing what the health system is about, or understanding what the health conditions could be, or using your medicines which the doctors have given you, how do you use it properly with prescriptions? Because a lot of time there are many medicines which are just given over the counter without prescriptions, and we are very used to it because they are lying in our medicine box. So the minute we have something, some loose motions or something like that, we just go pick up that medicine and have it because we feel maybe it's not. But if it persists for a longer period, if any symptom is persisting for a longer period, there is a reason that we need to go and check out. So we need to understand that. And as an organization, as we care, we have patient advocates, we have patient navigators in the hospitals. So more or less, when the patient is diagnosed, the patient is lost about when the diagnosis has been given to them, because cancer is daunting, cancer is shattering, and the caregiver who comes along, so it's our job as a patient advocate to talk to the caregiver to understand what they have understood about what the doctor has informed them, whether they know what the scan is about, whether they know that there should be a fasting done before the blood test that has been recommended to them. Every single step we try and guide the patient and the caregiver who comes to the hospital. Also, at the same time, we have a lot of material which we have information booklets on different cancers, and also on emotional topics which are out there at our hospital counters, so that the patient or the caregiver can pick it up and read it for themselves. These are in 4 languages we have been, and the 5th language we have just translated. So to make it easy, English and Hindi are the common ones which are, and these are being sent to Pan India wherever our doctors would like them to have. Along with the doctors, even where we do our awareness programs, we have a lot of awareness cards, the basic information about what does breast self-examination mean, or what is pap smear, everything. So these are the pamphlets that we try and distribute among the public, or the hospitals where the caregivers come or the family members are there. They are given it to them free of cost. So this is what I would like to say, ki it's not about how educated or how well-read we are. It is just about being very, very conscious of what our body is telling us. And that is what I think health literacy is for all of us. Thank you.
So it's my pleasure to introduce our final speaker. Raymond Vles is board chair of CLL Canada, a volunteer organization of patients and caregivers. He's also facilitator of the Quebec CLL support group, and he is a CLL patient who is currently in remission. He retired back in May of 2020 after 17 years of working for the City of Montreal in various capacities, including information system pilot, change management consultant, and internal organizational development consultant. Prior to working for the city, he spent 15 years as an independent consultant and a group facilitator, and he assisted clients both in the private and the public sector. He has also been executive director of an environmental NGO, nonprofit organization, and spent a year as an intern in the federal parliament in Ottawa. That's interesting. Yes. And 2 years working in a manufacturing company. He holds a master's in organizational development, as well as a bachelor and a master's in environmental studies. He lives in beautiful Montreal and is fluent in English et français? In English and French. That's all I know, I'm sorry. And in addition to his involvement with CLL Canada, Raymond is a board member of JazzWorks Canada. I want to hear more about that. And was also a previous member and president of the board of directors of CAMAC, which is the Canadian Amateur Musicians. So please welcome Raymond.
Thank you very much. I think I gave you too much information on my checkered past. Okay, let's see if I can get this to work. Okay, so what I'm going to talk to you about today is what is CLL and who is CLL Canada, what the CLL information challenge is for patients, of course, and the information strategy that we developed as a result, and the CLL Resource and Information Center, which is on our website, and how we selected the links and the information that is there, and finally our future plans. So, most of you know probably what CLL is, chronic lymphocytic leukemia, and it's a chronic disease, so this is the watch and wait period. And CLL Canada, we're all volunteers, and we're really in the business of particularly education and access to information, with a bit of advocacy, especially around HTA submissions and a few other things. And we have no staff, as I mentioned. So, what's the information challenge? I think you'll be familiar with most of this. The shock of diagnosis when you were told by your doctor that you have a cancer with an unpronounceable name that you can't understand, and you can't even remember once you're out of the doctor's office. You search for information. A lot of people, they go on Google and search for information, and you find a whole bunch of websites, but not much information that you can understand. So I was inspired by Sergio Leone's movie. I think of it as the good, the bad, the incomprehensible, and the out of date is what you find often. And so how do you find what you're looking for? How to make sense of all this cavalcade of information is really the challenge. So in discussion with colleagues, based on my own personal experience, we saw the need for a roadmap for patients. We think of it as a roadmap to navigate the CLL journey. And we thought of the questions that typically arise from patients, and it's often a lot the same questions. And we, being a volunteer organization, writing our own documentation was out of the question, and on top of the fact that there is a lot of good information on CLL, because it's a fairly common lymphoma, on the internet. So we thought we should link to the information, and now I was hoping to be able to go directly to the website, but that's not possible, so I'm going to show you pictures of what we did. And then I'll explain to you how we did it. So that's what it looks like. I think you can't really see very well. Is there a pointer here? Is there a pointer? No, but in any case, there's lines here, and these are individual, each printed thing is a bar. So they're individual menus that you can click on here, and they drop down. And then it's got this headline. It's got some text there, but I took that out just to fit it on the slide. And you can see that's the rest of our website there, cllcanada.org. And so these are samples of images from the menus that come down. So what you see, for example, what is CLL? That's one of the questions we have in one of our first Just Diagnosed. And so we have a video with a transcript. So this is a button that people click on. So the link is there, and it's got just a headline and then a little bit of a description. And so that's every entry here is in the same format. And we describe what people are going to see. So it's a video. In this case, read more on the Healthline website, a transcript, a video with a transcript. Read more on the Blood Cancer Uncensored website. So this is the kind of thing that you have on the whole. These are just sort of snapshots of parts of the menus that drop down. Here's some other on financial challenges, dealing with cancer at home and at work. And perhaps I should just run through here our titles. So we have Just Diagnosed. Really, that's probably the first priority that people come on the website for. And then we have a general menu here about get support, get informed, get connected. So those link to Canadian, especially CLL sites, with a few others. Links to forums like Health Unlocked and Cancer Groups, Cancer.io, I think, Cancer Groups.io. Anyways, a few forums and a few just reliable websites, sort of general kind of places where you'd go for good information. And then we have Living with CLL, all about the watch and wait period. Then finally, the decision to treat, what kind of treatments are available, how do you make the decision, what are the factors, all about navigating our complicated healthcare system and some suggestions and information on that. Complications, infections, we're all immune compromised, secondary cancers, etc. And finally, a menu on family issues, finances, and caregiving, so resources on those topics. So we've tried to cover the gamut, and as I mentioned here, with those menus. So how did we select those links? Well, we started by creating the framework I just outlined to you, and we sort of thought of the typical patient journey, and then we worked on the topics within each section. And then we had, on one hand, worked with our website developer to develop the concept of the menus and how it would work visually. And we had a volunteer searching for the links. And one of our board members did that. We actually tried to find a medical writer to do that, and nobody was interested in the contract, interestingly enough. So one of our board members stepped up to the plate and did an incredible job researching based on the framework that we had. And we had a committee to evaluate them. So he came up with, any given topic, he would come up with 4, 5, 6 websites. And with the committee, we'd all look at them together, and we'd decide, no, that one's not so good, but this one's a keeper. And so there was a selection made with this committee with volunteer board members on it. And then there was the final text, the formatting, and all that, the introductory text that had to be written, which I did. And then we'd send it to the webmaster in an Excel file, and he'd put it on the website. So it's a fairly straightforward process. Now, future plans, where are we going with this? I do want to mention that we've had an uptick of people signing up to our organization since we've put that online. We have more people signing up, so we can see people are coming to the website and are finding that a useful resource. So we'd like to keep adding content. We have to do the work to do so. That's a challenge also to keeping the site up to date because links get broken, pages change. And we have to figure out to install a website change monitoring program. There are websites or programs that you can get that will test the links at every week or every month, however you program it. And that will tell you if a link is broken or if even the page has changed, because we want to know if information changes on the page. So that's one thing that we have to do and get that done. We also want to translate it into French. Right now, it's only an English-speaking site, and 23% or so of the population of Canada is francophone, French-speaking, primarily in Quebec. And so we want to translate our whole site into French. I'm the first French-speaking member of the board, so that's probably another reason why we're just in English. And but we were puzzled here a bit on how we were going to translate the pages, because most of the pages that we link to are in English, and most of the content on the internet is in English. Fortunately, we have a board member who is a web designer and programmer, and he has done a link that incorporates Google Translate, and I hope this will work. It's just not clear whether it'll work live, but I'm going to click on this, and if all works well, we will see a page open up with it translated. Skip. Whoops. Here we are. Here. So this is this happens to be the site of American Cancer Society. But you can see it's translated in French here. It's all in French language. And the Google Translate banner applies here. So English detected, French. You could even select another translate. I think he's programmed, I guess, in the link and how he's programmed the link that it opens up in French. And I guess the one thing we have to think of is to put a warning to people, because Google Translate is not perfect. And you do get some bizarre translations at times. Could potentially even be unsafe. So we have to find a way. I don't know if we'll do it with a pop-up or something, a general warning on our website. We haven't really started the translation project seriously yet. But we have to deal with that issue to warn people that if they're going to follow this advice, they'd better double-check the translation. But I think that might be of interest to for countries where English is not the primary language. That you can use with this technique some English content on your website and get it translated. And I'd be able to share the link with you or how it's constructed, and if there's a lot of interest, maybe I'll ask Ross, our board member, to explain how he does it, how he does the magic web translation. So I think that was the last, that was my last slide. So thank you very much. And hope it's useful.
Really exciting. I hope that it's been informative for all of you. We've heard about definitions of health literacy, organizational, individual. We've had really great definitions from Catherine from the Milken Institute. Wynne, thank you so much for giving us a better perspective of the landscape within your country. And also sharing with us the success stories of House 086. So thank you, and thank you, Hongfei. We also heard about some patient experiences in India, and we applaud you for all the work you're doing through your programs. And I look forward to continuing to learn more about that. And Raymond, please correct me if I'm wrong, but we heard about the good, the bad, the incomprehensible, and the out of date? Yes. So we've allowed some time for some questions, and we welcome those questions for our speakers. There'll be some microphones that can go around the room, so by all means raise your hand. But if you'll indulge me, I'd really like to sort of just kickstart the questions. And I'm going to ask all of you, just in a line or two, just to give us your perspective, just as Amanda's getting situated with the microphone. So in the context of health literacy, because we understand it's a global issue, but it can also be quite complex. And some things are quite simple, but the complexity is really often at the systems level. So what does good health policy or good policy in the context of health literacy look like in practice? And Catherine, I'm going to put you on the spot to go first if you don't mind.
Is this on? Okay. So I would say that good policy for health literacy depends on what level of policy you're talking about or who the body making the policy is. So good government policy might be a little bit different from good organizational policy within your organization, healthcare systems. But the biggest thing is to make sure everything that you're doing is reducing the demands on your patients, on their families, on caregivers, making things accessible, and using buy-in from the community, listening to patient voices from organizations like y'all's to really make things accessible. I hope that answers a bit.
Okay. Actually, I have spoken about policy in my speech. So at first, I think powerful or strong policy is very, very important. But whether a policy is good or not can only be known by implementation and testing. So, but I still think there's something necessary for making a good policy. The first, clear objectives and priorities, and then a feasible and practical action plan, and the monitoring, evaluation, and improvement mechanism. And I think, and the fourth, I think, maybe the most important, that let everyone understand and know about the policy, so everybody and different parties can participate and collaborate for it. That's my perspective.
When policies are made, the main thing I think is to understand the patient communities, because for them the policies are made. The people who are making the policies need to understand the, the feel of what the patients really are looking for. So I think then it is simple, and then it will be implemented. If it's complex, it's not going to be implemented.
Well, I have to figure out what to say after all these very interesting observations, and I would say I would limit it to one thing, very specific. At least in Canada, we find that the medical community and health professionals in general don't refer patients to patient group websites. Some do, some nurses do, but as a generalization, the referral is very poor, and that would be a system-level improvement, and I think would be major if when people got their diagnosis, they got a list of websites they could visit and places to go for more information.
Thank you for sharing those observations. Questions?
I have some questions for the speakers. First one maybe applies to all countries, all speakers, and maybe in particular to Milken Institute. My question is, in your experience, can we quantify the benefits of good health literacy to patient outcome? For example, increase in overall survival or reduction in mortality?
Is this one on as well? Okay, good. There is absolutely literature on that. If you're interested, I'm happy to send you some citations. But it's all very specific to the researchers doing it. But yes, there's people who have studied the specific costs, the specific increases, et cetera. But that is in the broader scientific literature. It's not something really, I think, that people understand or hear about.
Do you have any other questions?
Any feedback from the other speaker?
Yeah, I just talk about a study conducted by Beijing Cancer Hospital, and it showed the outcome has been improved in recent years. We think that the improvement of health literacy is a crucial factor, because the improvement of health literacy of patients can help patients better understand their conditions and follow the physician's treatment plan, medication, and also do better self-management of their health. I think this is definitely improve their outcome in finally.
Can you measure or quantify the benefits? Measure and quantify the benefits?
Actually, this is a very good question, because we don't have the data to show how much literacy we have improved through our efforts. But we have a thought that maybe in the future we can cooperate with physicians to co-design a health literacy maybe questionnaire, just like China government do that and to measure the health literacy and the linkage with clinical outcome maybe in the future is our thoughts.
Thank you. My second question is, in your experience, all the speakers, including Kathleen, what do you think, in your experience, what do you think are the major barriers or obstacles to achieve higher health literacy in your countries, and how can they be overcome? In particular, I admire China reaching such higher health literacy in this short period of time. But if I read the slide correctly, it's about 30%. So in your mind, do you think it is possible to increase to majority, say 50% or higher? What do you think the major challenge or barriers are? And that applies to the Milken Institute or the other two speakers. Thank you.
Do you want me to try? Yeah. I mean, I think there's a whole range of factors. I mean, the one I mentioned, which is the health system not referring people to information sources being one of them, doctors not making the reference to patient groups. But, you know, it takes a real effort, first of all, to write literature that people with not, especially people who have not a lot of schooling can really understand. And it's all education levels in the country have an impact. There was another point that somehow escapes my mind right now.
So
but there's a whole range of factors that have an impact.
So education has an impact. Thank you.
I think it does have an impact because, you know, are you used to dealing with concepts or not? That makes a difference, I think.
Well, thank you so much for that question. I think we only have time for one more in the back, and then I'll turn things back over to Lorna.
Well, thank you. I'm puzzled by a couple of things. Well, the first thing, there's a lot of things to say about this, of course, but I'm in a double thing here. I'm a surgeon, and my wife has a cutaneous lymphoma, so there I am in the cutaneous lymphoma patient organization. And what I must say is that it starts when I go with my wife to the expertise center. I mean, we make a small list of things that we want to ask, and then when we head back to our place, which is half an hour in the train, we still have the same questions because we haven't had the answers because we forgot to ask them. And now I'm a health professional, and even I just forget things. With the word cancer, I'm taken aback. So it starts, I think, and that is the answer also to the man for you. I think it starts with educating doctors, because I was trained to see a person that comes in with something like a lot of information that is what you want. You want a patient to have, you want to have an informed patient, but it is a bloody nuisance for your clinic because that will take you half an hour. So it is the system, but I think it starts with the doctor. It starts a layer beyond, it starts with where do I go to? Okay, I've got a lymphoma, so where do I go to? Well, obviously you're sent to the nearest hematologist. But is that the right one? We had this discussion at our table. I sometimes tell my patients, you have to ask me, would you operate on your child, or would you send your mother to me? And they just say, okay, I'll ask the question. I said, no, I wouldn't. I would go to, for instance, Nijmegen, because there's a head and neck surgeon there that's doing nothing but this thing that you're having. So it's all about educating the doctor. I think that's where it starts, really.
Thank you very much for
just
sharing that perspective. We appreciate it. I'd like to
Marjorie,
thank everyone.
A quick response.
Yes.
I've often felt that as patients coming in, especially new patients, just diagnosed, they need a coach. And I think while it'd be great if doctors could educate patients, I don't think they have the time. But I think if you had somebody with the expertise to coach patients and to talk to them and know how to talk to them and playing a kind of coach function, that would be the best thing.
And if I could suggest that the two of you connect, because I know we've had conversations on that topic as well, and I think that would be wonderful. Thanks so much. This concludes my part, and Lorna, over to you.